Hello, it is my pleasure to walk you through home administration of subcutaneous immunoglobulin, or SCIg therapy. My name is Christy Fisher, and I am a home infusion registered nurse. This video will show you how your immunoglobulin will be administered in your home. A registered nurse will be scheduled to administer your first home dose and will instruct you on how to administer your immunoglobulin medication. For your first few doses, your nurse will support you in self-administration until you are able to independently administer your subcutaneous immunoglobulin. This usually takes 3 to 4 doses, but we are here to support you until you are comfortable with self-administration. Once you are independent with your immunoglobulin administration, your pharmacy will have nurses and pharmacists available 24 hours a day, 7 days a week to support you during and after your infusion. A pharmacy representative will contact you before each dose of immunoglobulin to make sure your immunoglobulin therapy is effective. He or she will also check to see if you are experiencing any new symptoms, including site irritation or leaking, in addition to any supplies you will need. They will also check to see when your next immunoglobulin infusion is to be administered. Your pharmacy will be able to adjust your immunoglobulin therapy to minimize symptoms, such as adjusting the rate of the infusion, providing longer or shorter needles to better access the subcutaneous tissue, and increasing or decreasing the number of infusion sites. When each delivery arrives, you should go through it to make sure the immunoglobulin product is the product your physician ordered, and all your ordered pre-medications are included in the delivery. Pre-medications may include Tylenol, which is also called acetaminophen, or Benadryl, which is also called diphenhydramine. It is important because different brands of immunoglobulin are not interchangeable, like over-the-counter medications are. Taking a different brand of immunoglobulin may cause unwanted side effects. Subcutaneous immunoglobulin will be administered on a mechanical pump connected to tubing with needles. Depending on your immunoglobulin brand and the dose your doctor ordered, the number of infusion sites will vary from 1 to 6 sites. Most patients have 2 to 4 infusion sites. The pump will look like this. Tubing sets and needle lengths vary. Your tubing will look like one of these sets, having 1 or more injection sites. Needle length is very important. It is important for the immunoglobulin to be injected into your subcutaneous tissue or fat layer. This image shows tissue layers. It is important to make sure the end of the needle is securely seated in the subcutaneous or fat tissue. You may notice pain at the injection site if it is infused into your muscle or skin tissues. Additionally, if it is infused into your skin tissues, you may experience redness, hives, or itching at the infusion site. Your nurse will make sure your needles are the correct length during your first infusions. And once you are independent administering your immunoglobulin, your pharmacist will be able to help if needed. Make certain you let your pharmacist know if you lose or gain weight because you may need longer or shorter needles. It is important to drink plenty of water before your infusion to keep yourself hydrated, unless your doctor has advised a fluid restriction. Being well hydrated will help prevent you from having side effects. Typically, you will not experience any symptoms with your immunoglobulin infusions. Call your pharmacy right away if you experience headache, dizziness, lightheadedness, low-grade fever, itching, rash, hives, leaking at the infusion site, nausea, vomiting, or diarrhea during your infusion. After your infusion, you will need to monitor for these symptoms and for decreased urine output and changes in urine color. Call your pharmacy if you experience any of these symptoms or if you miss a dose for any reason. Although allergic reaction is rare, your nurse will tell you what symptoms to watch for and instruct you on how to use the epinephrine kit delivered to your home. Your pharmacy brochure has a link to a video to show you how to use your epinephrine kit and outlines reaction symptoms that require calling 911. Under the direction of your doctor, our job is to help you live your life as you normally would, regardless of the health challenges you may have. Before every dose, your pharmacy will reach out to you and start this process over again. We will also ask you how your infusion is going, if you're experiencing symptoms, provide support, and answer any questions you may have. We will be in close contact with your doctor throughout your immunoglobulin therapy. Thank you so very much for selecting us for your subcutaneous immunoglobulin needs. We look forward to being part of your healthcare team.